Fluid therapy is a fundamental intervention in the management of patients in emergency and critical situations. Its main goal is to restore and maintain the homeostasis of the internal environment by regulating volume, osmolarity, acid-base balance, and electrolyte levels. In critical contexts, adequate fluid replacement can rapidly reverse shock states or prevent hemodynamic deterioration. Intravenous fluids are classified as crystalloids and colloids. Crystalloids, such as normal saline or lactated Ringer's solution, are the most commonly used due to their availability, low cost, and effectiveness in expanding the extracellular space. Colloids, on the other hand, contain high molecular weight molecules that remain longer in the intravascular compartment, although their use is more limited due to possible adverse effects. The main indications for fluid therapy include hypovolemic shock, extracellular volume depletion, acid-base balance disorders, and prolonged fasting. It is also used as a vehicle for drug administration or to maintain a patent venous access. The choice of fluid type, volume, and infusion rate will depend on the patient's clinical condition, weight, age, and underlying pathology. Continuous monitoring is essential to prevent complications such as fluid overload, hyponatremia, or pulmonary edema. In emergency settings, where decisions must be quick and precise, fluid therapy represents a key therapeutic tool to stabilize the patient and gain time for the implementation of definitive measures.